evening. Welcome to PBS Social Work Hour. My name is Shanice Smith, and I will be your host and in-house social worker for today's show. Today, we will be hearing from different stakeholders who have experienced substance abuse dependence and discuss if clinical social work services are enough to ensure people recover from drug addiction. Substance abuse has been an ongoing issue examined from many perspectives. Our goal at the end of this show is to analyze substance abuse, examine social, biological, and psychological factors that contribute to abuse, and discuss how stakeholders can continue to address this issue within the field. Can we have each of our panelists introduce yourselves and who you are?
Hi, my name is Cassie. I am in recovery from addiction, and I am also formerly homeless. I work as a peer recovery specialist, so I assist other people who are trying to get into recovery and also become stably housed.
My name is Bronwyn, and my mother was a former addict, and she also was homeless for a while. She got into heroin when I was a teenager, and she was depressed, and it kind of spiraled downward from there. Fortunately, we were able to help her get treatment and get off the streets, and we now have a good and stable relationship.
Hi, I'm Liz. I am an emergency room nurse, and I deal with people who occasionally come in for overdoses or other issues related to substance dependency.
Hi, my name's Ebony, and I'm a police officer, and I help offenders who is struggling with addiction to help reduce the risk of recidivism and relapse.
Awesome, ladies. Thank you for being with us today. So let's jump right in. Our first question is going to be, how do we get people who use substances to buy into treatment, and what are some treatment options available right now?
As a support, or especially as a family member, I think one of the things to understand is that she didn't start with the idea that she was going to get hooked. She didn't do it purposely. And also, I needed to put aside a lot of the feelings that I had before of like shame and embarrassment, and just show a lot of empathy and respect and support and kindness for her. And we also found that if you could take advantage of some kind of a crisis-driven window of opportunity, maybe they were injured or overdosed, or those times when they are really more willing to change, that helps. We also try to describe what we were seeing through our eyes as family members, because sometimes their reality, what they perceive to be reality, can differ from what we see. And one of the most important things was not to make her feel stigma or shame for getting help. Rather, we wanted to try to motivate her, to show her how it would help her, and it'd help kind of heal our whole family, and let her know that the whole family was going to play a role in the treatment. So the biggest thing that I tried to do, other than be supportful, was to provide her hope. So as far as treatment options, she did a detox, residential treatment, and counseling, and then did long-term follow-up care, which was really important to help sustain the recovery. And that addressed employment and housing and mental health issues. There's other types of therapy too that we did. We did family therapy. She did some group therapy. There's a whole bunch of options. And so that's kind of how we got my mom to buy into treatment.
And I agree with what Rowan said. And I think in addition to having the support, absolutely being ready for change is crucial for getting into treatment. If you're not ready to change, then even if you are in treatment, you're bound to fail.
Thank you for that. So in kind of following Cassie's thing about being ready, and Bronwyn's about all of the different treatment options that are available, we know that there are many systemic components that play a role in substance abuse, prevention, dependence, and use. So what role does the criminal justice system play in addressing addiction?
The criminal justice refers people who are dealing with addiction through many different methods, such as sending nonviolent offenders to treatment instead of jail, or stipulating treatment as a condition of probation. And also the courts arrange treatment as an alternative to incarceration.
I have to say that my mom had a few brushes with the law, and from what I saw, just throwing in people in jail doesn't help change the problem that got them there. In fact, almost half of the people that end up in jail have some kind of a co-occurring mental health disorder, such as anxiety or depression. For my mom, it was depression, maybe bipolar disorder. And for some, this may be the easiest way to access the drug treatment. But a lot of people, probably I think research says about half of the inmates with a history of addiction relapse within a month because there's a lot of stresses coming out of jail that they're just not equipped to handle. The other thing is that the cost of treatment really pales in comparison to the cost of imprisonment. I mean, depending on when somebody's in jail, it can cost anywhere from $30,000 to $60,000 per year when you take into account the health care, the medical care, the psychiatric issues, maybe medication that's needed. So in the long run, the treatment is going to cost significantly less.
I agree more or less with what she said. The way that the laws are set up now, essentially, if you are mentally ill and homeless, you are criminalized just for being mentally ill and homeless because you don't have a place to sleep. Also, you know, the war on drugs is a fundamentally racist policy.
And following other systematic components, the healthcare system is definitely involved in abuse. And I know that there's new research where doctors are looking at how they can participate in substance abuse prevention within their offices. So how can healthcare professionals better address addiction within their practice?
So I think healthcare professionals, especially nurses and doctors, should try to focus on harm reduction more than anything else. I mean, they're already trained to provide the medical care, but a big issue is just bedside manner. You know, like a lot of nurses and doctors have negative attitudes towards individuals with substance dependency issues and homelessness. And they look at those individuals with disdain because, you know, it's their belief that they brought the problems onto themselves or, you know, whatever along those lines. And it makes, you know, people who have these issues less likely to seek treatment because, you know, they don't want to have to deal with that stigma and have to feel shamed anytime they need some sort of medical treatment. And doctors especially swore an oath to do no harm, and it doesn't go out the window just because someone is homeless or uses drugs.
I think that the problematic drug use is among the homeless is associated with having unmet health care needs and also the problems accessing the addiction treatment. I agree with Liz that there needs to be a change in attitude towards the homeless. They should be more compassionate and caring, you know, not so abrasive, more motivating to get them into treatment. You know, my mom was sometimes treated this way, and I discovered that part of the reason for this, for the negative attitudes, goes back to just a limited space to treat these people because of budget shortfalls in the healthcare system, and more of the healthcare system is directed towards people that have the ability to pay for their treatment and for their healthcare. Many of these people wait until they're very sick to go to the ER so that they're not going to be turned away. And at that point, they're in like the worst state possible. You know, they might smell, they might have huge abscesses, and that turns a lot of people off. And I think that's, you know, part of where it comes into why they're treated the way they are. So anything to make healthcare more accessible would really help. Mobile healthcare clinics and psychiatric clinics, maybe home visit programs to homeless encampments or shelters, transportation that helps get people from camps to clinics or shelters to clinics. I think also education and training should occur within the practices to kind of improve the cultural competency towards the homeless. in regards to their needs and their realities. And last, I think that as health care professionals, they can also advocate for kind of a better integration of Medicaid and the block grant funding to make sure that more people can access the treatment and have the wraparound services that are necessary.
I agree with all of that, and especially with the being stigmatized when going to seek medical treatment. That has been my experience. You know, especially when you have a true medical issue that you need to seek medical care for, you're discriminated against by the healthcare professionals just seeing as a drug seeking person. It's especially a problem for women of color not being taken seriously when you are seeking medical help.
Thank you guys for your thoughts on that. So, and kind of going forward with the approach in the healthcare, what type of approaches should be taken with treatment? Do we believe that there should be a multi-systemic approach or a more one-size-fits-all type of treatment?
Well, I definitely think that treatment needs to be holistic in nature, kind of part of a comprehensive plan that addresses the medical, psychological aspect of it, perhaps vocational if people don't have jobs, housing, legal, and other social needs. Homelessness is the symptom of a problem. It's not the problem itself. I think that's widely misunderstood. And all of these aspects wrap around each other and need to be addressed in order to truly help a person. And also to make sure that the co-occurring problems, if there are any, are also properly addressed.
And you know, I don't think that multi-systemic and individualized services, I don't think that those are two mutually exclusive things. You know, the person that's seeking services should be the one that's in charge of their treatment. If they feel like they have no say or are forced to do some type of treatment, then the treatment won't be successful. And you know, it's my belief that a strengths-based, person-centered type of treatment is really empowering to someone, knowing what your strengths are and building on that, as opposed to being constantly reminded of what's wrong, is more empowering.
Treatment should meet the client's certain needs. The criminal justice system should work with the public health system to help offenders engage in treatment by using engagement methods like motivation to get them into treatment and retention methods, tailored interventions to get them to stay in treatment.
That's a really good point that you made, Ebony. I know in the criminal justice system that many people are forced into treatment and there's not a lot of individualized approaches. And sometimes when we talk about people who are involved within treatment, they don't really have too many choices of the supports that they can have or who really is involved in the treatment process. So that moves into our next question, you know, who is involved within the treatment process and who makes that decision as to who they to be involved?
I think there's a lot of different pieces to the puzzle when it comes to treatment. You know, some individuals will require more help than others, but generally everybody should be provided a strong treatment team. That it should include doctors and nurses to help through detox if that's something that's needed, psychologists, social workers, counselors to help with any underlying mental health issues like trauma or PTSD, depression, or potential psychotic disorders, and addiction specialists and family and other support, and definitely social workers that help after the fact, after treatment, to find employment and housing and, you know, continue support beyond treatment, like in support groups and things like that.
I agree with Liz. I think a comprehensive team needs to be involved to give the best, most effective care to clients. Everybody with whom the addict interacts can act as encouragement and motivators towards treatment, but treatment should also be as self-directed by the patient as possible so that they buy into the whole process.
I definitely agree with that last sentiment that ultimately it's up to the person that's seeking treatment to decide what they want and don't want to do as far as the services they receive. You know, it's good to have all of these different choices, but ultimately it's up to whoever's when you're going to see the for treatment. You can't force anything on anyone.
I definitely agree with that. So with that being said, how can family members and or other identified supports assist the substance abuse user in their recovery process? And what steps should those supports make or take?
When we found out about my mom and her situation, we really wanted to try to help get her into treatment as soon as possible. So I think one of the things is to be proactive in finding treatment that is best suited for the patient. Of course, you know, something that falls within the budget. Maybe be open to family therapy, not only for the help that might be needed with the family dynamics, but also so that the patient knows that you're committed and your support for them. You know, make it a process about all of us too, and trying to fix the problems that we have. Make sure, you know, the other things are just like making sure the appointments are kept, maybe that the team stays informed of what's happening from what we see, any medication that's taken, you know, help make sure that happens. And you know, of course, like encouraging total abstinence and making sure that they're in a safe place without temptations, whether that be home or, you know, if they're without a home, just some place where there's not people that will tempt them. And another thing too is helping them develop good coping skills so that they can deal with the stresses of life without turning back to drugs and alcohol. For my mom, participation in peer support groups was really helpful. And then for us, knowing the signs of relapse was important as well, so that, you know, if she was headed down that road, we knew what was happening and could make sure that she was back into treatment. And just kind of keeping her hope alive and helping her direct herself to find meaningful activities that meant a lot to her and gave her a sense of purpose.
So I guess just to kind of explain a little bit more, there was a study done in the 1970s called Rat Park, and you can find it on the National Institute of Health website. But researchers found that rats that were left in a box with nothing to engage them except water laced with heroin, they would continuously choose the water laced with heroin over regular water and food until essentially they died. But a 2018 study that was kind of recreating that, but allowed them to have something mentally stimulating, and there were other rats around, so they weren't just left in a box with nothing. They continually chose social interactions over the water that had heroin in it, and they basically were living a normal life, and then they didn't need it as much. And so I think that kind of just shows how important social support really is and what social isolation can do to someone, especially when they're facing addiction. And a lack of support can really fuel that. So I think family members and friends should really be aware of the importance of that and do their best to be there and be supportive during the treatment process.
And I think that peers, like peer support specialists, can really help the recovering person build a new community. You know, when you're in recovery, you lose a lot of your former life. You know, in 12-step, they say you have to change your people, places, things in order to avoid triggers. And peers can help create a new social structure to do that. Also, you know, when working with peers, you feel less alone or stigmatized because they have had a similar experience to you. So you can connect to someone on that level and feel less alone. Also, when you're trying to cope with homelessness, having a strong support system can help possibly divert from actually getting on the street. you can help them brainstorm different resources for where they could possibly go, or people that could help them.
So thank you, ladies. We've talked about individuals experiencing homelessness, and we've talked about strong family support systems. What are some other mitigating factors to consider when contemplating entering treatment?
I think that one of the most important things is to make sure that the individual is ready, and that services are provided at the individual's present level of change. And make sure that they have a say in the process, because if not, they're set up for failure. We tried to get my mom into treatment a few times when she wasn't ready. And so there's several different stages of this. They progress from like a pre-contemplation stage where they don't really have any intention of changing, to kind of weighing the pros and cons of taking action, then deciding to act and making the plans to do so, going into the treatment and starting to change their behaviors, and then trying to maintaining it. So there's all these different parts to it, and you need to make sure that you meet them where they're at. And also just choosing a program that shows respect and dignity towards the clients is important, to help build up trust and most importantly, the self-esteem, which will help them address issues in their life after they get through treatment. And then, another issue, of course, is the ability to pay. There are free and low income treatment centers. There's centers for people of all, socioeconomic levels. It's just, unfortunately, there are fewer, for the less money that you have.
And I agree that being ready is the most important factor in being successful in completing treatment. That and having a strong support system for once the actual acute part of treatment is finished, to help sustain the recovery.
So in examining more systematic issues, should race and socioeconomic status be considered when it comes to treatment interventions? And if so, can you guys please provide some examples?
I definitely think that it should. Race should be considered because of cultural differences that might be important in the treatment process, like religion or moral values. And it could potentially be a barrier to treatment. And socioeconomic, especially when considering the homeless population, should be considered because it can also be a really huge barrier to treatment. A lot of treatment facilities are really expensive, so someone with little to no income isn't going to be able to afford those services. And there would just need to be a really strong consideration of income when determining what treatment options are available.
Yeah, kind of along the same lines. There's a lot of structural inequality built into the healthcare system, as well as the limited ability to access treatment for those that can't pay, which ends up discriminating against people who are poor and homeless. And I think that needs to be recognized when choosing treatment. Those who are poor inevitably have fewer options, but the more successful treatment options would also address the reasons why people turn to drugs, including their homelessness, their inability to be financially stable, as well as potential trauma, maybe their inability to find or hold a job. And addressing all these issues will help keep them from relapsing.
So we've talked about socioeconomic status potentially being a barrier, as well as cultural differences. So what are some other barriers people encounter trying to enter treatment?
I think a lot of people become socially isolated when they lack self-esteem. So that's a big issue. Also, lack of transportation over to the treatment centers. And then this delivery system is often really fragmented and complicated. And I think people get really frustrated with that. It can be difficult for people to get into the system if they don't have an advocate to help them. We were able to help my mom with that. The length of time it can take to get into the system, I think a lot of people end up missing that critical window for entry when the person is ready. So as a family, we've been able to help my mom with all of that.
There are many different barriers that prevent people from entering treatment, such as health insurance, because many people do not have it, the high cost of treatment, and the lack of resources because they don't know where to find help.
And I agree with the financial barriers. Treatment can be very expensive, and even the most affordable ones, there can be very long wait lists. Additionally, fear of fear of getting treatment, because sometimes you've been using for so long, you don't know what your life is going to be like after you stop using, and stigma um, associated with your situation, your homeless status, and that of being addicted to drugs can cause you not to want to enter treatment.
So, in talking about the barriers, what are some improvements that can be made by each stakeholder in the field when it comes to addressing addiction? So, I'll actually answer that question first while you ladies get a chance to think about it. From the social work perspective, I think overall there should just be better collaboration among all of the stakeholders, healthcare, criminal justice, and other social agencies. There also needs to be reform in healthcare. As we've talked about earlier, there are a lot of disparities within healthcare. Medicaid doesn't cover all types of treatment, and then you have people who have private insurance who may still have private insurance, but they may not address certain detox facilities or other residential facilities for people to go to. Of course, reform on the criminal justice side. I believe it was Cassie who brought up the war on drugs and how certain policies were created based off of inequality. So certain drugs, which are the same in science, are looked at differently. And again, just a better collaboration in total, because even though Bronwyn, it seems like you guys were really supportive of your mom, there are people who don't have that support system. So when they are transitioning out of these facilities, what other agencies are working with them in order to make sure they aren't going to experience homelessness again, or getting them, the wraparound services that are needed to be on their feet. All right. Anyone else?
I think improvements to medical care would just involve more compassionate care and harm reduction, which might include more training for individuals who come into contact with the homeless population or individuals struggling with substance dependency. The medical community owes it to the individuals that they serve to provide the best possible care and not further their trauma. The last thing someone who's experienced trauma needs is someone who's supposed to be helping them and taking care of them and making the issue worse. Doctors and nurses should never allow personal beliefs and opinions to get in the way of proper medical care.
And as a peer or family member, I think it's important to understand that people don't choose to become addicts. Families need to be aware of codependency issues and be more upfront and acknowledging of the problems instead of brushing them under the rug. They need to understand that these the patients are not lazy, but they're battling against structural discrimination and kind of political forces that reduce their opportunities for help and change. And then honor their resilience and help them build their self-esteem.
The criminal justice system and the public health system needs to work together so that the criminal justice knows how to deal with someone who is battling addiction. There needs to be better jail-based programs to help deal with addiction in the system and better resources after the release from prison. Treatment for incarcerated individuals with addiction should include continuing care and monitoring after incarceration, treatment, and parole.
And I think that federal use of a housing first policy would really help out people who are struggling with substance use and homelessness, to really penalize people if they are struggling with substance use and end up, breaking the law. It just restarts the whole cycle.
Awesome, ladies. Thank you. So after reading Righteous Dauphine and participating in this discussion, What are some concluding statements or takeaways that you have gained from this assignment? So for me, I found that it's really important to treat each client who has a dependency issue differently. There is not a one fits all approach. It's important to examine the aspect of the whole person, taking holistic treatment into consideration, and even looking at the different cultural or systematic components that have affected and contributed to them being dependent.
So after reading Righteous Dopamine, I learned that a lot of individuals who struggle with substance dependency are victims themselves and have experienced deep-rooted trauma. I already understood the trauma aspect, like pre-addiction, but victimhood tends to continue beyond the initial trauma, and these individuals are treated like subhuman and struggle to find compassionate care, whether it be in the home, in healthcare settings, or within the legal system. We wouldn't treat someone with PTSD or severe depression that way, but when trauma comes out as substance abuse, we kind of just lose our compassion.
After reading Righteous Dopamine, I learned that clinical social work services are not enough to ensure that people recover from addiction. Addiction for individuals in lower socioeconomic classes is often the byproduct of different contributing risk factors that result from genetic and environmental influences, such as limited parental attention, maybe due to their need to work, single parent family, living in low income housing, limited access to healthcare, maybe untreated mental issues, maybe lack of education or family violence. And some of these factors can result in turning to drugs or alcohol for stress reduction. So unfortunately, there's a disconnect between those that create these policies to help these individuals and those that try to implement it. And that kind of results in policies that don't reflect the needs of the people or that provide too much or too little change. Sometimes there's also a lack of coordination between people who establish the healthcare, employment services and policies, housing policies, a disconnect between the national and the local levels, often leaving the social workers to advocate for the intended changes. So policymakers don't always pay attention to the impact on the people for whom the policy is intended to serve, and the resulting consequences may often be more harmful than helpful, leaving the social workers to help navigate the system of policies, because there's many discriminatory practices towards those with addictions and who are homeless.
After doing this assignment, I found that there are a lot of people that are struggling to get into treatment for addiction, that there's a lot of people that do not know where to find help for addiction. There needs to be a better long-term treatment to make sure that they're getting the adequate amount of resources after they have finished their treatment.
After reading Righteous Dopamine and reflecting for a little while on it, it made me think about how the medical industrial complex, in combination with all of the various reasons that there is a lack of affordable housing, like gentrification, and just all of the different reasons, that homeless individuals need to be advocated for, especially since these people are treated so poorly and often less than human. It's also very important to use people first language to minimize the stigma and dehumanizing effect that they experience.
Awesome, ladies. Well, thank you for joining us tonight. This will conclude our session for this evening, and we'll see you back tomorrow.